Hi everyone, my name is Eugene L, and today I'm going to tackle about 6 topics: the postpartum hemorrhage, the uterine atony, the laceration, retained placental fragments, uterine inversion, and uterine rupture. The postpartum hemorrhage. It is defined as more severe bleeding than usual following a childbirth. It is more likely with a cesarean birth and is most likely happen after the placenta is delivered, but it can also happen later. So when we say postpartum hemorrhage, it is a heavy bleeding after the birth. The causes of this is if the uterus does not contract strongly enough after the delivery of placenta, the bleeding vessels in the area where the placenta was attached will bleed freely. So if I remember in my maternal one, the third stage of the labor is the delivery of the placenta. So after you deliver your placenta, your uterus contract with the blood vessels that was attached to it in order to stop the severe bleeding after the delivery. Tear in the cervix or tissues of the vagina, of course, it can also cause postpartum hemorrhage. Tear in the blood vessel in the uterus. Bleeding into a hidden tissue area or space in the pelvis. Blood clotting disorders and placenta problems. So what are the symptoms of postpartum hemorrhage? Uncontrolled bleeding, increased blood pressure, increased heart rate, decrease in the red blood cell count, swelling and pain in the vagina and nearby area if bleeding is from a hematoma. Treatment is replacing lost blood and fluid is important in treating postpartum hemorrhage. So your care provider, although the lost blood is already controllable, but you still need to IV in the form of IV blood transfusion to replace the blood that was lost during the postpartum hemorrhage. Treatment may also include medicine or uterine massage to stimulate uterine contraction, removing pieces of the placenta that remain in the uterus, back rib balloon or a Foley catheter to put pressure on the bleeding inside the uterus, exam of the uterus and other pelvic tissues, the vagina and the vulva, to look for areas that may need repair. Laparotomy. This is the surgery that is it is a procedure where they will open your abdomen to find the cause of the bleeding. Tying off or sealing bleeding blood vessels. Hysterectomy is removing your uterus. In many cases, this is the final choice. The postpartum hemorrhage can be divided into primary postpartum hemorrhage and the secondary postpartum hemorrhage. When we say primary postpartum hemorrhage, this is the first 24 hours heavy bleeding after the delivery of the baby. When we say secondary postpartum hemorrhage, this is between the 24 hours to the 6 weeks after the delivery of the baby. Now let's go to uterine atony. Uterine atony refers to a soft and weak uterus after childbirth. It happens when your uterine muscles don't contract enough to clamp the placental blood vessels shut after childbirth. This occurs when your uterus doesn't contract or tighten properly during or after birth. It is a serious complication that can cause life-threatening blood loss or the postpartum hemorrhage. Uterine atony can also occur during a miscarriage or other uterine surgeries, and it can be a complication of vaginal births or C-sections. However, not all lead to postpartum hemorrhage. So when we say uterine atony, if the postpartum hemorrhage refer as the heavy bleeding after the childbirth, the uterine atony refers to a soft and weak uterus. So your uterus will be soft and weak after childbirth if your uterine muscles doesn't contract strongly enough to the placental blood vessels after the childbirth. Treatment. The goal of treatment is to stop the bleeding as soon as possible and replace any lost blood or fluids. Your pregnancy care provider typically begin treatment by massaging your uterus to promote stronger contraction. Your pregnancy care provider typically begin treatment by massaging your uterus to promote stronger contraction. In some cases, this massage in the uterus is already enough to treat the uterine atony. In addition to uterine massage, after the delivery, your provider may use several medications to help your uterine contract. These medications include pitocin, methengine, cytotic, ergot alkaloids like argemethrin. Surgical treatment. Surgical treatment is if those treatment mentioned earlier is still not working, this surgical treatment is needed. So uterine curettage. Uterine curettage is when your provider scrapes retained blood or placental fragments or tissues in your uterus. Uterine artery ligation. This is when it is a procedure where they will tie off the blood vessels to stop the bleeding. Uterine artery embolization. This is a procedure is done by the use of small sand-like particles to block the blood flow to your uterus. Hysterectomy is the removing of your uterus. Now let's go to the laceration. Definition and causes. Laceration, a cut in the skin that exposes underlying tissues. A laceration can be due to a sharp object or other force to cause an irregular tear that causes the underlying stiff tissue to open. In addition to lacerations, other wound types include avulsions, abrasions, and puncture wounds. So when we say laceration, example of this is when you are trying to cut a fruit and then unintentionally you cut your fingers. It's called laceration. It is a cut in the skin that exposes underlying tissues. So there are different types of wounds. The puncture wound, the avulsion, and the abrasion. So when we say puncture wound, as seen in the picture, it appears small in the surface, but it's actually in the deep of the in the deep of your tissue. Example of this is when you knife. When you get stabbed by a knife, it appears small inside, but it is the wound is actually in the deeper muscle. Avulsion. This is when some of the tissues are already missing. Example of this is when you accidentally cut your fingers, and that is called avulsion. So the tissues are missing. Abrasion is when it's just a scrape, it's just in the upper surface, in the outer surface of your skin. Example of this is when you get accident and then your skin scrape in the highway. That is called abrasion. Two types of laceration. Superficial laceration can typically be treated without medical attention. As what I've mentioned earlier, the abrasion is also a type of superficial laceration because it is the areas affected is only the superficial part of your skin. Deep laceration require medical professional to adequately clean and close the wound. A surgeon may use stitches to close a wound. The best example for this deep laceration is the avulsion because some of the tissues is already missing. But a puncture wound is also example of the deep laceration. Treatment. When treating lacerations, the primary goal is to stop the bleeding, minimize pain, and prevent infection and reduce scarring. Superficial laceration, the treatment for this is clean the wounds with clean water or a clean cloth to stop bleeding and prevent blood loss. Apply topical antibiotic ointment to reduce infection risk. Use a clean bandage to protect the wound from bacteria and change it regularly. After that, contact a physician and update the tetanus vaccine if needed. In the deep laceration, require a medical professional to adequately clean and close the wound. A surgeon may use stitches to close a wound. Again, in the deep laceration, the cut or the laceration is already in the deeper tissues of your skin. That's why it needs a medical professional assessment. Now let's go to the retained placenta. It is when the placenta doesn't completely come out of the uterus after the baby is born. Retained placenta can lead to severe infection or life-threatening blood loss for the mother. So when you say retained placenta, the placenta is not completely out of the uterus. So what causes retained placenta? Sometimes the placenta takes longer than expected to be delivered. The placenta can be retained after your baby is born if your contractions aren't strong enough to expel it. The placenta is unusually strongly attached to the wall of the uterus. You have placenta acreta. So signs and symptoms. Sometimes a piece of placenta is left behind in the uterus. If this happens, you may develop symptoms days or weeks after the birth. This may include fever, a bad smelling discharge from the vagina, heavy bleeding, large pieces of tissue coming out of the vagina, and pain. So the treatment of this is emptying your bladder, doctor or midwife gently pulling on the umbilical cord, and if the two doesn't work, you will need a procedure to remove the placenta. You will be taken into surgery after the birth and given an epidural or anesthetic so you don't feel anything. Now let's go to the uterine inversion. It is a rare complication of childbirth that occurs when part of the uterine wall collapses and turns inside out. Considered an obstetric emergency, if left untreated, uterine inversion can lead to life-threatening hemorrhage and shock. So uterine inversion is your uterine wall already collapsed and turns inside out. Like imagine a sack being pulled inside out. That is imagine like that. Your uterine wall will look like that. What causes uterine inversion? Incomplete separation of the placenta from the uterine wall. As a result, the placenta pulls the uterus with it and it emerges from the birth canal. The uterus is also more likely to invert if it's overly relaxed or if the umbilical cord is pulled too hard during the delivery. That's why the umbilical cord should be pulled gently during the delivery of the baby. So there are 4 grades of uterine inversion: the incomplete inversion, the complete inversion, prolapse inversion, and the total inversion. So when we say incomplete inversion, it is when the upper part of your uterus collapsed, but it hasn't come through the cervix. When we say complete inversion, the uterus turns inside out and is already coming after the cervix. When we say prolapse inversion, the uterus is coming out of the vagina. So when you say total inversion, both the vagina and the uterus protrude inside out. Signs and symptoms: abdominal pain, excessive bleeding, signs of shock. In a complete inversion, the uterus will be visible in the vagina already. Treatment. There are 3 goals of treatment: return your uterus to its original position, stop the bleeding, and prevent the inversion from happening again. Your doctor may try to fix your uterus by hand, hydrostatic correction, flushing saline solution into your vagina. Imagine a sack being pulled inside out. It will form a cup, so that is the position of the uterine inversion. So your doctor will place clamps in the uterine ligaments that enter the cup, then gently pull on the clamps until the inversion corrects itself. Now let's go to the next topic, the uterine rupture. It is a serious complication where uterus tears or breaks open. It is most common in people who have had a C-section, previous C-section delivery, and then try for a vaginal delivery or vaginal birth after cesarean. A uterine rupture can be complete or incomplete. So when you say uterine rupture, your uterine does already tears. Complete uterine rupture, the tear goes through all the layers of your uterine wall. Incomplete uterine rupture, the tear doesn't go through all 3 layers of your uterine wall. Causes of this: most uterine ruptures occur at the site of a previous C-section, scar during labor, and a subsequent vaginal delivery. This is because the delivery of the baby stretch the scar of the C-section. So there are really possibilities that your uterus may tears or breaks open. Symptoms of this is non-reassuring fetal heart rate, fast heart rate or low blood pressure in the pregnant person, sudden and severe abdominal pain, vaginal bleeding, contractions that don't stop, and labor that don't stop or slows down. Management and treatment of this uterine rupture. If your uterus ruptures, your provider will deliver your baby right away. Then they'll repair your uterus with surgery. Sometimes a hysterectomy is necessary if you're losing a lot of blood. Healthcare providers must pull your baby from your abdomen quickly and be prepared to administer emergency care to the both of you. So that's all. Thank you so much.